If you're over 50 and you've recently caught yourself thinking, something feels a bit off, but I can't quite put my finger on it, I want you to stay with me, because sometimes it's not your age, not your stress level, and not just sleeping badly, but a quiet change happening in the body that most people don't notice until it's been there for a long while. Your kidneys are a perfect example of that kind of quiet change. They're not dramatic organs. They don't usually announce problems with sharp pain or obvious warning lights. They just keep working, day after day, filtering your blood, balancing fluids, helping manage blood pressure, and clearing out waste your body doesn't need. And because they're so steady, people often miss the early hints that the filtering system is under strain. Let me paint a picture many of my patients recognize. You wake up and your eyes look puffier than they used to, almost like you had a good cry the night before, except you didn't. You feel a little foggy getting started, and it takes longer to warm up mentally than it used to. At night, you're up to use the bathroom more often, and you can't remember the last time you slept straight through until morning. Or maybe food just doesn't taste quite right lately. There's a faint metallic taste that makes your usual breakfast less enjoyable. None of these things on their own prove anything, but in real life, the body doesn't always send problems one at a time. It often sends a cluster of small signals that are easy to shrug off, especially when you're busy living your life. Here's the simple explanation. When kidneys are working well, they keep the right things in your bloodstream, like proteins and minerals your body needs, and they let the right things leave, like extra salt, extra water, and chemical waste. When the filters get worn down over time, you may start seeing signs that the balance isn't as tidy as it used to be. One common sign is a change in nighttime urination. A lot of people assume, quite reasonably, that waking up at night is just part of getting older. Men may blame the prostate. Women may blame bladder changes after childbirth or menopause. But there's a pattern I want you to recognize. You're not drinking extra in the evening, yet you're still getting up multiple times, and the amount you pass isn't just a few drops, it's a decent volume. That can happen when the kidneys lose some of their ability to tighten up urine overnight. In a well-tuned system, your body shifts into a sort of nighttime mode so you can sleep. If that concentrating ability fades, the bladder fills more quickly, and your sleep gets chopped into pieces. Another clue can show up right in the toilet bowl, urine that looks unusually foamy or bubbly, especially if the foam lingers rather than disappearing quickly. People often tell me it's probably the cleaning product or it's just how the water hits the bowl. Sometimes that's true, but persistent foam can also mean protein is slipping through the kidney filters. Protein belongs in your blood, not in your urine. Think of the kidney filter like a very fine screen. When it's intact, it holds on to bigger, valuable particles and lets the smaller waste pass through. If that screen is damaged, protein can leak out. And when protein leaks out, the body can start holding on to fluid in odd ways. That's where the morning puffiness around the eyes can come in. The skin around your eyes is thin and soft, so fluid tends to show up there first, especially after you've been lying flat overnight. You might look in the mirror and think, I look tired, even if you got a reasonable night's sleep. Now, swelling can also appear lower down, around the ankles and lower legs, and again, there are plenty of causes. But here's a practical little check many seniors find helpful. At the end of the day, take off your socks and look at the elastic line. If it's leaving a deep groove that hangs around longer than it used to, that's worth noticing. Then, gently press a thumb above the ankle bone for a few seconds and let go. If it leaves a clear dent that's slow to fill in, that suggests fluid is sitting in the tissues. When kidneys struggle to handle salt and water efficiently, the body can retain more fluid than it should, and gravity pulls it into the legs over the course of the day. Fluid balance is also tied to breathing comfort. Some people notice they need an extra pillow or two to sleep well, or they feel a bit breathless doing things that used to be easy, walking to the post box, carrying groceries, climbing the stairs at home. Many assume it must be the heart or the lungs, And sometimes it is, but the kidneys and the heart work as a team. If the kidneys aren't keeping up with fluid removal, fluid can back up where you don't want it, and breathing may feel heavier, especially when lying flat. That "I breathe better propped up" pattern is something I take seriously because it's the body's way of asking for a closer look at fluid management. There are also mouth and stomach clues that people rarely connect to kidney health. A lingering metallic taste, food tasting strangely off, or breath that seems unpleasant despite good oral hygiene can happen when waste chemicals build up more than they should. Your body is always trying to get rid of what it doesn't need. If the usual exit route, the kidneys, slows down, the body sometimes vents waste in other ways, including through saliva, which can change taste and breath. Along the same lines, some people develop a pattern of morning nausea or a poor appetite early in the day. They may feel better later, which makes it tempting to ignore, but that morning queasiness can reflect waste levels that are highest after a night of less drinking and less flushing. And then there's itching, the kind that isn't just dry skin. I'm talking about a deep, persistent itch that can move around, back, arms, shins, scalp. People try new soaps, new laundry detergent, stronger moisturizers, even prescription creams, and nothing quite touches it. When kidneys are under strain, minerals and waste products can drift out of balance, and nerve endings in the skin can become overly reactive. It's not that your skin is dirty or that you're doing anything wrong. It's that the internal chemistry that normally stays stable is wobbling. Sleep and comfort suffer, and when sleep suffers, everything else feels harder: mood, memory, energy, patience. Speaking of memory and energy, let's talk about the senior fog that so many people describe. This is one of the most misunderstood patterns I see. A person who has always been sharp starts losing words, misplacing things, struggling to focus on a book or follow a conversation, or seeming unusually tired and flat. Families understandably worry about dementia. But the brain is extremely sensitive to what's in the blood. If the kidneys aren't clearing waste efficiently, those chemicals can affect clear thinking and concentration. It can look like aging, it can look like depression, and yes, it can resemble early memory illness. The reason I bring it up is not to alarm you. It's to remind you there are body-based, fixable reasons that thinking can feel cloudy, and kidneys are one of them. Another practical sign that often gets brushed off is frequent nighttime leg cramps, those sudden, painful Charlie horses in the calf or foot that pull you out of sleep. People blame not eating enough bananas or not drinking enough water. Hydration and diet do matter, but your kidneys are a major manager of the minerals that muscles use to contract and relax. If mineral balance is off, muscles can misfire more easily. If you're getting repeated cramps despite decent hydration, it's worth taking the pattern seriously rather than chalking it up to bad luck. Changes in urine amount can matter too, and it goes both ways. Some people notice they're passing less than usual, and it's darker, almost like strong tea. Others notice they're passing a lot of very pale urine that looks almost like water. The first pattern can reflect the body holding on to fluid. The second can reflect poor concentrating ability. Either way, it's a shift from your personal normal, and that's what matters, your baseline. Sleep can also change in an odd way. Louder snoring than before, waking up gasping or feeling unrefreshed even after a full night in bed. Some of that is anatomy and age, but fluid shifting through the body can play a role too. When you're upright during the day, fluid tends to collect in the legs. When you lie down, that fluid redistributes, and in some people it can crowd the tissues around the throat and make breathing noisier or more interrupted. The reason I'm walking you through these examples is simple. Kidney strain in later adulthood often shows up as little things in several different areas: sleep, skin, appetite, urine, swelling, breathing, thinking, rather than one dramatic symptom. Now, let's move from understanding to practical action you can actually take. The first step is not to panic, and it's not to guess, it's to get clear numbers. Ask your doctor for kidney blood work and a urine check that looks for protein leakage. In plain language, you're asking, how well are my kidneys filtering, and am I leaking protein into my urine? Those two questions go a long way. Next, get serious, quietly serious, about salt. I'm not talking about never enjoying food again. I'm talking about noticing where salt hides. Bread, soups, sauces, ready meals, deli meats, cheese, takeaway foods. Many people cook sensibly at home and still end up with too much sodium because it's built into packaged foods. Reducing hidden salt helps the kidneys and helps blood pressure, and that combination protects the filtering units over time. Blood pressure matters here more than most people realize. High pressure is like forcing water through a delicate filter at a higher and higher setting. Over years, that wears the filter down. If you've been told your pressure is a bit high, it's worth treating that as important, not optional. The goal isn't perfection, it's steadiness. Also, pay attention to pain pills. Many people in their 50s, 60s, and 70s rely on common anti-inflammatory tablets for back pain, knee pain, arthritis flares, or headaches. Used occasionally in a healthy person, they can be reasonable. Used frequently, especially in someone whose kidneys are already under strain, they can be rough on kidney blood flow. The key is not willpower, it's having a plan for pain management that doesn't quietly punish your kidneys week after week. Finally, be sensible with fluids. Some people force themselves to drink large amounts because they've heard more water is always better. For many, steady hydration is helpful. For others, especially if swelling and breathlessness are creeping in, too much fluid can add to the problem. The best approach is not a one-size rule. It's paying attention to your body and getting guidance that fits your situation. If you've been listening and recognizing yourself in several of these patterns, say more nighttime trips to the loo, new ankle swelling, foamier urine, a metallic taste, itching, or that frustrating brain fog, I want you to take it as a sign to get curious, not scared. You've taken care of a lot in your life: family, work, bills, repairs, other people's problems. This is one of those moments where a little attention pays off, because kidneys tend to do better when we notice trouble early rather than late. And even if it turns out your kidneys are fine, you'll have gained something valuable: peace of mind and a clearer picture of what's really behind the symptoms you've been living with.